I never really thought this day would come. I met a patient about 20 years ago, a retired professor named Elizabeth, who came to my clinic. She was dying of pancreatic cancer, and she asked me then whether cannabis might help her. And I said no, because that's what I learned in medical school. She reached into her briefcase, took out a 3-inch tall stack of articles, put them down on my desk, and said, "Really, doctor? You should read these. You might learn something." And I did read those articles, every single one, and found a bunch more. And I did learn something. I learned that there actually is some medical benefit to cannabis that I had not anticipated, never heard about in medical school. Second, I learned that there was a lot we don't know. And third, I learned it's really, really, really difficult to do high-quality, randomized control trials of a substance that's federally illegal. This rescheduling has the potential to change all of that and to rewrite the way that we do research related to cannabis in the United States in 3 ways. First of all, it'll democratize the research process so that all academic institutions can participate in research, not just elite academic medical centers. Number 2, it'll give patients and researchers access to highly refined, reliable sources of cannabis rather than relying on 1 or 2 sources around the country. And last but not least, it'll let us do the sorts of large-scale randomized controlled trials that we do in oncology and cardiology. Not dozens of patients, but hundreds or thousands of patients. That's how we learn, that's how we produce valuable knowledge that's useful in guiding treatment decisions. Mr. President, without you, this never would have been possible, and my patients and I and all of our families are grateful. Thank you.